I'm here with Dr. Andrew Hartz. Thank you, Dr. Hartz, for joining me today.
Thanks for having me.
So I want to give a little bit of background before asking you to give a background on yourself. One of my hobbies as a psychologist who feels very isolated and alone because so many psychologists and therapists do not have traditional family values. One of my hobbies is to try to find other like-minded individuals. And of course, most of the time I fail miserably at that. Don't find anyone. Google search does not come up with anything. Maybe that's because of the Google algorithm. Probably it's on the blacklist of Google. But one day in the not so distant past, I discovered this website, Open Therapy Institute. And what did I find on this website? So, what I loved about this website: overlooked issues in mental health care, overcoming social and political bias in mental health care. So at first you think, well, this is something from the heart of wokedom, social and political bias, of course. But then I realized that this guy is doing exactly the approach that I would have recommended myself, which is you use the woke terms to categorize your own attempt at bringing traditional values into the field, because that turns them on their head. Like, who would be against social and political bias, or against addressing it, I should say.
Yeah.
So it turns out that there is someone doing what I was looking for so long, and that's Andrew Hartz. So can you just introduce a little bit yourself and your institute and the other initiatives that you do?
Sure. Yeah. I'm a clinical psychologist. I'm based in New York. We founded the Open Therapy Institute, I'd say in stages. I mean, it was over a year ago that I wrote an op-ed for the Wall Street Journal announcing the Institute. A few months later, we got incorporated. And then only this past summer, we actually started offering programming and really operating. So it's taken a while. All the steps take time to get moving, but now we actually have programming. And what we do is exactly what you said, which is addressing sociopolitical bias in mental health care. And I do think one way of thinking about sociopolitical bias, I know we're going to go into more depth, but that there are lots of patients who struggle to find a therapist because of concerns around bias. And I think those patients are the most underserved patients, or the most poorly served patients in the country. There is kind of like, maybe there is a woke phrase of underserved populations, but I think people that are underserved because of concerns about bias are probably by far the most poorly served patients in the country, because they have virtually no resources. Therapists get almost no training in how to work.
And you're talking about bias against traditional family values.
Not just that. I mean, I think, yes, that is a group. I think people who have traditional family values are a group that would really struggle to find an attuned therapist who got their values and their worldview and clicked with them. But it's not actually. We get contacted by a lot of people who are liberal, but they got canceled, or they're self-censoring, or they're worried about being canceled, or there are aspects of maybe the identity politics ideologies at their school or work where they feel attacked. Maybe they're falsely accused of harassment or falsely accused of bias. There are lots of different things that people could experience. And they might be liberal. They might be a liberal in some ways, but they're struggling to find a therapist who gets the issues that are important to them.
And I want to point out here that you have the double whammy, which is having the right values, and then also having a high degree of professional competence. You're a PhD. You're a psychologist. It's very rare to find that combination. It's like a unicorn. So I just, from one unicorn to another, just want to hand
thanks. Of course. Well, and I'm so glad that you reached out. I do think there's maybe it's not the whole issue of family values, but if you were thinking about faith as connected to that, I mean, a lot of therapists get no training on those issues. So it's not just that the field skews very much in a secular atheist direction, but they're not getting training. And actually, most psychologists are upset that they didn't get more training on these issues. Like they even know their training is atrocious. Like in my doctoral program, I didn't have one lecture on faith-based issues, which is absurd. And so a lot of people that I know who are therapists, they don't ask about faith to their patients. Patients often assume that they can't bring it up. If they did bring it up, they're clueless. And it's such a loss because it's not just about, it is like, it's sad to think that patients would see a therapist and think that they had to silence their own values in therapy, and many do. But it's like, what a missed opportunity, because their faith can be something that helps them overcome what they're struggling with. And it's not being utilized because the therapist is clueless. And so the therapist doesn't need to necessarily be, an angry activist atheist and yell at them and think their religion is dumb. And they don't need to be that over the top to be biased in ways that really hurt the treatment. They can just be clueless and avoid it or not know anything. I mean, those are all forms of bias too. And it's a huge loss for the field.
Exactly. Especially now that we have so much research showing the benefits of religious service attendance. There's a ton of great research coming out of Harvard School of Epidemiology, Tyler Vanderwill, showing this. But as you say, therapists, researchers, they wouldn't even be aware of that. And they would think that if I do address religion, it's going to be on a subjective basis, which still has value, but it's not showing the full picture.
100%. And there is this whole, religion is a really interesting place. Faith-based issues are a really interesting place where bias manifests, I think, in a unique way, because there are faith-based counseling programs. There are researchers doing scholarship on this. There are studies like the ones that you cite. They're out there, but they tend to be siloed. They're in this like corner of the field and the rest of the field often has no training or access to it. So for people who the faith-based counseling services tend to be utilized by people that are very observant and maybe particularly attached to one community. But there are lots of people with traditional family values or religious values who maybe they want to see somebody outside of their community, or maybe they don't have a community that they're attached to the same way. Their faith might still be the most important part of their life. Where do they find somebody? It's like, it's this kind of all or nothing thing. You either get somebody who's totally in the silo, or you get people often who have no training at all. And there's not a good middle ground.
Right, exactly. And then the problem with the people in the silo oftentimes is that they lack the training in modern psychology, by which I mean evidence-based treatments, empirically supported treatments, the actual science. So once again, finding someone who can combine both the values and the science-based treatment is a gem.
Well, and I think I just think it's a system issue. It's a problem with the field. I think every therapy training program in the country has to have training on faith-based issues, period. Because there's no way you're going to get through your career as a therapist and never treat a patient whose faith is important to them. That's just not achievable. Like, it's like you're going to see somebody, you're going to encounter it one way or another. And I just think it's not functional to just have therapists be this clueless about something that's this important.
Especially when you consider we get training in things that are statistically unlikely to be encountered. I don't think I've ever worked with a transgender patient, but of course that was heavily emphasized. So it's the bias.
Well, that's changing though. I mean, 10 years ago, I knew very few therapists who had ever worked with somebody with somebody who identifies transgender. Now, I think almost everybody I know does, because the rates of transgender identification seem to have gone up so dramatically. In my career, from the beginning of my training, when I really knew, early in my training, I think it might have been my first patient that I saw, or one of them, was identified as transgender. And I had no idea what I was doing. This was my first clinic that I'd ever worked in. And I was like, I need somebody who knows about this. And this was in Brooklyn. And nobody knew anyone. This would have been 2014, wow. I think. Nobody knew anyone.
That's not even that long ago.
That's not that long ago. And now I don't know anybody who doesn't. Like, it's like almost everyone I know has at least one transgender patient, sometimes multiple. So what happened? I mean, and the other interesting thing about that story is how quickly the field went from nobody knowing. Like, when I took abnormal psych as a PhD student, I don't think we had a unit on transgender stuff. Like, it wasn't even part of it. And then it was a couple years later it was just kind of announced that there's this new consensus in the field on that issue. And I knew it wasn't founded in robust debate because I knew that when I was trying to learn about it just a couple years ago, I couldn't find anyone.
Yeah. Yeah, and Abigail Schreier has done a great job of documenting that huge increase, specifically among teenage girls in particular, in her book Irreversible Damage. And we could get into that, but
Yeah.
the other condemning piece of that is those who were the most prolific, well-respected researchers were silenced because their research showed that the appropriate intervention, which is watchful waiting, is not what the Marxist ideology wants to promote.
Well, that's one of the populations that I think really struggles to find providers, and there are good resources that are emerging there. There's Therapy First, and there are organizations like that that I think do good work in that area. But I was finding that I don't know if you've encountered this, but there are people who have these secret lists of acceptable therapists, and maybe you know of these lists, but they share them in a community. The therapist doesn't want to be outed as doing this work, so it's secret, and the people don't want the therapist to face consequences, so they just circulate it amongst themselves. And it's such an indictment of the field that finding an attuned provider requires a secret list. It shows, like, by the time you get there, I think you're kind of like, we've got a big problem in our field with sociopolitical bias. Like, it's just not serving people adequately. And the need to create a secret list is a perfect embodiment of how entrenched the bias has become.
It's huge. I had Soed Tabrizi on this show a few weeks ago, and she has this group of conservative social workers and other counselors, therapists. And so that Facebook group functions as kind of like a secret list. And what happens is people who disagree with them join the Facebook group and then get the information of these therapists and then report them to CPS. So it shows that why people are keeping it secret.
Yeah, and the field, should have an ethos. And I think, even though I do think the bias has been there for a long time, I think prior to the past decade, the ethos of the field was you have to be patient-centered. Like, you have to be attuned to your patients. And that includes conservative patients, it includes religious patients, it includes people with any values. And it's just about being an attuned, empathically engaged, knowledgeable therapist. And I think that's the thing that unfortunately is slipping away as more and more of the field embraces activism.
But why would therapists not be attuned to their patient? That is their whole
Right.
essence as a therapist.
Totally. I mean, I think I'll steelman the argument. I mean, I think like the way that they see it is like, are we supposed to be neutral about racism? So we're not going to be neutral about racism, right? Racism is wrong and it's not good for people. So it makes sense for us to be fighting racism. And since racism is anything that doesn't agree with me, I should fight with anybody who doesn't agree with me. I mean, that's kind of how the sequence of events usually kind of unfolds. But I think they see it, that's how it's rationalized, that therapists who wouldn't treat a Trump voter. Why? They're racist. I don't need to treat racists. And if they do come to see me, I'm going to confront them about their racism in the first session. And if they don't want that, they can leave. So I think that's how a lot of it gets, or it's sexism or homophobia. It's like whatever the issue is, they have a way of giving it this label that enables them to clash with patients, I think, ultimately, and it leads to bad care.
Well, and it shows that there is a disguised assumption there, which reveals a double standard, that these people are the first people to say that, oh, we don't impose our values. You don't want to impose your values on the patient. But that's precisely what they're doing. They talk about tolerance, but in fact, they themselves are not tolerant. So it would be more forthright to recognize, yes, actually, we do have values, and we may be even imposing them on our patients. And it would be impossible not to have values. That would be very difficult. So let's just at least recognize and acknowledge that, and maybe determine who we want to work with or how we want to work with someone who has different values.
I would say, I think about bias as I think of it as having basically four levels. The most biased therapists are activist therapists. These are people that are explicitly and deliberately bringing their political values to bear on their therapy. I'd say the next level are people who are very biased. They're going to avoid topics, shut down conversation about things, maybe clash, maybe assume the patient agrees with them on things and cross boundaries and things like that. But kind of, they have very strong values that lead them to clash. They're not deliberately trying to impose an ideology on sessions, but they're still clashing. I'd say the next level is people who are very well meaning. They don't want to impose ideology on patients. They try not to, but they don't have any knowledge about other value systems or other views. And so they have tons of blind spots. They don't know how to help. They often don't know what their blind spots even are. And so they can kind of like be nice and muddle through it. Like we were just talking about religion, like that's a great idea. Like I think to most therapists, competency with faith-based issues means being nice about it. It's like somebody says they're religious and you say, I'm okay with that. And that's the extent of what they can do. They can't really have a conversation about it that's educated. They don't really know anything about it. They can't really use it in the treatment in any meaningful way, but they can be nice about it. And a lot of those people, they're not trying to be biased. They are nice. A lot of them are. But then I'd say the optimal level is a skilled therapist. And that's somebody who really has knowledge of a wide variety of sociopolitical issues and how they impact patients and can be curious and empathic and engaged and helpful and has some thoughts about it. And that's where we want people to be. And I think right now, I don't know, I don't have data or like of how many percentage of therapists fit into each of those categories. I think the activists are not a huge percentage. They might even be 10%. Maybe it's as high as 20. They have an enormous influence because they tend to control training programs and academic research and professional bodies, but they're actually like not most therapists, I think. The biased therapists, I think there's a lot of that in the field, but the skilled therapists, I think, are extremely hard to find right now.
Yeah, that's a helpful distinction. Let's get into this document here that you've prepared. I'll share it for people who are watching this on video, and then we can also talk through it for those who are just listening to the audio.
Great.
Okay.
Yeah. This
diagram.
Yeah, this diagram is kind of like a central diagram that guides the work at the Open Therapy Institute. It's a chart of issues in mental health that are overlooked because of sociopolitical bias. And so these are the types of issues that often there's no academic literature on them, or it's limited or biased. There's often no trainings on them, or they're limited or biased, or there's no services on any of these issues. So people who experience these things don't know where to go to find a therapist. So I'll just quickly read through these because if we have people who don't see the chart, it goes from things like political stress, which could be hiring quotas at work, politicized trainings at work, DEI trainings at work. It could be cultural dynamics like authoritarianism in culture, politicized messaging in movies and the arts, conformity dynamics, things like that. There's self-censorship, which is reported by a lot of people. There's plenty of reason to think that self-censorship can impact mental health symptoms and come into therapy. Masculinity issues, young men, boys, marriages, families, different ways those can come up, anti-male bias or harassment, false accusations of sexual assault or things like that. There's anti-white bias and aggression that's really not researched, contrary to other forms of racial aggression, which tend to be researched heavily in the field. This one is something that the field's very uncomfortable with. Obviously, all forms of racial aggression are abhorrent, but for anti-white, aggression is often ignored. There's sex and gender issues. There's faith-based issues. There's issues with conservatives in therapy, other racial issues, anti-Semitism, political conflict in families. There's other things. I'll kind of just bring your attention down to the bottom center bubble here of other overlooked patients, which includes gun owners. For example, like how knowledgeable are most therapists about gun issues? Are they skittish around guns? Do they pathologize guns? How much do they know about working with them effectively in psychotherapy? Most don't. Law enforcement issues, veterans. There's an interesting one in here too about abortion regret. We have a talk coming up in a few months of a therapist who does work on women who have an abortion or terminate a pregnancy in another way, or maybe have a miscarriage, and and what are their experiences like? And there's lots of those can be really potent experiences, and I think a lot of therapists are uncomfortable talking about them. So you can get a sense quickly, just summarizing these, just that there are dozens and dozens of things that people can experience as individuals that could impact symptoms or just be important life events that could come into therapy and impact treatment, that therapists might be flat-footed about. They might be uncomfortable, they might avoid it, or they might just not be knowledgeable about it. A lot of these issues just don't have research. The case studies aren't there. The interventions, the evidence-based interventions haven't been developed. Like masculinity, for example, like it's an issue that I think comes up a ton in couples counseling and family counseling. It's kind of shocking how overlooked it is, as if like, how could it not come up regularly? Almost like you'd think it'd just be a mainstay of those treatments, and it's often ignored, or just treating adolescent boys or young men. And a lot of them struggle with questions of how to be masculine in a way that feels authentic and assertive and self-respecting, but positive. And they might embrace either like a self-hating masculinity and feel the need to emasculate themselves or demonize their masculinity, or they might take the other road and kind of develop like a malignant masculinity that's aggressive, and because the culture kind of teaches that masculinity is negative, and so they embrace those negative traits perhaps. So there's just, in each one of these issues, you can think of dozens and dozens of ways that they impact people and come into therapy. And we don't have research about the prevalence of them, how they impact symptoms, how they're experienced, how they come into therapy, how therapists might respond poorly, how they could respond better, what types of interventions they might do. And thinking about all those questions from a psychoanalytic perspective, or a cognitive behavioral perspective, or a DBT or ACT perspective, or a family systems perspective. We don't have this literature. It's just like, it's not a gap in the literature. It's tons of huge topic areas that are frequently experienced by, I think, millions of people experience these issues. And it's just a blank space.
I wish I had this diagram when I was in some of my courses. Like, this would have been good, a good fodder for discussion. Well, so a couple ones here maybe we can focus on. So self-censorship and cancellation. The reason I'm focusing on these is because the mission of this podcast is to inspire the next generation of virtuous leaders. And the biggest challenge that such people face is fear of cancellation, or fear of negative social pressure, or pressure at work. It's kind of like a nameless fear because they actually never have tried to speak their mind or speak the truth. So yes. How would you address these people?
Yeah, that's such a great question. So our last workshop was at Open Therapy Institute. Our last workshop for therapists was on self-censorship. And we came up with a number of different things that are really helpful. Again, we need research on these, but I think these are a good starting point for thinking clinically about self-censorship. First things first, the number one cost of self-censorship is probably isolation. When people self-censor, they're fake. Even if they have lots of acquaintances, those people don't really know you because they don't know your values. So there's a profound sense of loneliness and isolation. The first step often in overcoming self-censorship then is about connecting to other people. It's the social piece. It's not the only piece, but I think that's often the first step. Before you kind of stand on the table and take everybody on, you have to develop some connections and talk through things with people who are open-minded or like-minded, wherever you can find those connections. And I think one thing I'd say is it's harder than it should be for people to find those connections. Often people don't know where to go. There are ways that people can find other people though, and start to kind of test the waters and open up. So that's my first point. The second thing is people can start, one thing, this is a behavioral approach, but they can start dealing with self-censorship by doing little experiments and seeing what happens. You don't need to start with the most extreme thing. One of the first experiments, this is Camilo Ortiz just did this workshop, and he suggested one of the first things you can do is just not nod in agreement with things you don't agree with. Just don't nod and see what happens. Yeah, we have this intuition. So a lot of people are nodding as if they agree, and they don't agree. Just try not doing that. So you're not even saying anything. But you can also ask a question. You could say, somebody might say this, how would you respond? You can take it step by step. And I think sometimes people need communication skills around it. Sometimes people need a space. I think this is part of where therapy can come in. There's so much bent up emotion from having not spoken that one of the dangers is then when people do speak, they're totally flooded. They're enraged, they're
That's a good
anxious,
point.
they're overwhelmed. So the ability to kind of process some of that beforehand so that it's not, the dam breaks and then you're disorganized. It'd be easy for people to have trouble staying in that middle ground when they start to speak up and to kind of go too far, and then you make enemies, or you're overly aggressive and you're not effective. That's something too. And the other thing I'd say it's important about self-censorship is like every context is different. So like there are places where I might advise somebody like you're at a university department at a small liberal arts college on the East Coast or something, and it's a totally politically captured field. What are you trying to gain here? Maybe you feel like you need to speak your truth just to tell them what, or whatever. You need to just say it because you believe it, but you might not need to do that. And if your goal is to persuade people, you might not be effective there. There are other places where maybe they have these really aggressive diversity trainings, but there's people there who are open-minded about it. And you could suggest like, maybe we should have a diversity of viewpoints here, or maybe some of these trainings are crossing a line and there are people who would be open to it. So the context is different. Individuals' personalities are different. And that's why it's helpful to kind of like unpack, like, what do you want to achieve? What's your temperament like? What's your situation like? So that you can think strategically about how you want to respond. I don't really think it's like a one size fits all. Everyone who's self-censoring should follow this like ABC thing, because the situations are so different.
Yeah, good point. And that's why it's hard to advise people oftentimes, because it's based on circumstances. But you've done a good job of breaking out the potential steps, which I've already learned from. I wish I had known this when I was being canceled by my former supervisor a couple months ago, because I fell into the break the dam approach and just let it flow. But I don't know.
I'm sorry to hear that. What happened? Or you don't have to go into it. But...
Well, it's kind of funny actually. Maybe I should do an episode on it at some point. But I got 3 emails within the course of a week from 3 of my former supervisors with varying levels of aggression and disapproval, saying basically like, stop being such a hater and cease and desist based on the values on my website, which I don't say anything negative on my website at all.
Right.
I believe in the principle of drowning evil in an abundance of good. But just talking about traditional family values, which is dignity of human life, created male and female, and the beauty of chaste love, that's already perceived as an aggression and as a hateful statement. So, of course, they, in their kindness, deigned to try to inform me and, bring me back to the truth and the side of light. They failed, and I'm still irredeemable, unfortunately, but I'm trying. Maybe if I do more of this bias training, I'll be able to see things from another light. But yeah, that was kind of fun.
They were basically, they thought that your clinical approach was wrong, or they just disagreed with your views and didn't want you to have them, or?
Yeah, that's a good question, because then, all right, where does it overlap with the clinical? And so one of my former supervisors said, okay, what would you do if you had a client who identified as trans, and would you, let's say he's a man who says that he's a woman, like, would you call him she, or do you even believe that a man can identify as a woman? So then I had like one of these rare sparks of genius that hits me from the divine every few years. And I asked him, do you think it's okay for you as a white male to identify as a black man? And he was stunned into silence. He had no idea where to go with that. And then he tried all sorts of outs, like, it's very complicated. Like, even what is black, what is white? It's very oh, well, what about what in my culture? And like, well, yeah. Okay, let's say that you grew up in a predominantly black neighborhood. Would you be able to identify as a black? And he was not able to answer the question. So that's what I find helpful in these conversations is just approaching it more Socratically, responding with questions, or that they it forces them to realize that, well, I have really no way of answering this.
Yeah, that's really interesting. But you said it, but it was not a good experience. Is that what or
In the
was it?
sense that I don't know if it had any positive impact. So yeah, if I were to do it again, I may think about it different. One thing I did not realize until I was in these conversations is just how ignorant these people are. That they're so surrounded by people of their viewpoint that they have no conception of the assumptions that their viewpoint is based on. I enjoyed debating with people, dialoguing with people, having philosophical discussions. But there's no, they have no philosophical reflection on their viewpoint or where it came from. I talked to, and these are people with PhDs who literally, one of them teaches a course on multicultural perspectives. And I mentioned like, yeah, I mean, this is just like an offshoot of Marxist ideology. And she had no idea what I was talking about. So
Right.
that's one thing that now that I'm aware of that, I would approach it differently because I just assumed that they knew where it came from, but they believed it to be correct. But in fact, they don't even know where it comes from.
I mean, I think that's right. I mean, my sense is that sociopolitical values are really at the heart of what cultural competency actually is. What the term actually means is like the ability to work with people from different backgrounds. If you can't work with people with different sociopolitical views and values, you don't have cultural competency. But the way that cultural competency is usually defined in the field is to say it's race, gender, and sexual orientation, and those are tend to be framed exclusively from a particular worldview that sees some categories as victims and others as oppressors, and it has this whole ideology with it. So it's like it's very cultural competency is one of those issues where it sounds like a really good thing, and maybe if they lived up to what it sounds like, it could be a good thing. But too often it's just merged with these very narrow ideologies that actually lead therapists to clash with more patients, ironically, than to work better with people.
Yeah, they do a good job of disguising it with a veneer of truth. And then it becomes difficult then to disagree with it, especially if you're using their own terms, which we probably are because we're so immersed in the culture. Well, if you don't mind me asking more from like a personal perspective, what inspired you to get into this? Because I have to say, I believe it takes an incredible amount of courage and also intellectual acuity and also business acumen to be able to start and develop and promote something like the Open Therapy Institute. Tell me about what inspired you, how you did that.
Oh, man. So, I mean, I saw the field get totally taken over by, I think, a really hateful form of identity politics in the last couple of years of my training in particular. And by the end of my time, like of my doctorate, I was struggling to
Where
get
was
through.
that?
I did my PhD at Long Island University in Brooklyn,
Got it. Okay.
and I was. I mean, ironically, the first 3 years of my program, which were coursework at LIU, really weren't that bad. I do think there was political bias in the field, but just not more than is like the standard in the field. I didn't have terrible experiences at that program by any stretch. I thought it was a good program in a lot of ways, but on my training sites, I had a different experience, and I did encounter a couple training sites in particular that were just painful to get through because it was just multiple times a week, another training that if you disagreed with it, they were going to attack you, and they were aggressive and degrading. I just couldn't, and I could see it impacting the patients. I could see it impacting care. And so I started writing about it. And what I recognized was I started writing as a critique of like the things the field is doing that were bad. I wanted to say, look at this activism in the field, and it can hurt patients and it can hurt training. But I started to realize as I was doing it that there's as much bias in what the field wasn't doing as what it was doing. So there's the activism that the field was doing, but the other side of it is all the groups of people that weren't being helped because the field just wasn't concerned about what they were experiencing. And I had I was lucky enough, I did like a lot of therapists who are in therapy or psychoanalysis for a big part of their training. I did that. And I was lucky that my analyst was open to actually hearing what my sincere experiences were and actually being supportive with them. But that was like, for a lot of it, that was my only point of support. And I thought, how do people get through really hateful programs like this if this is happening at their work or they're a hospital employee, it's happening there, or they're teachers at a school or at a university? How do they get through it when they have no support and they don't know where to find anybody? If somebody came out to me and they said, hey, I'm getting canceled, or I feel attacked for my views, or I'm isolated for my views, or whatever, where do I find support? I had nothing for them. I wouldn't even know. I was like, I don't know where to find somebody. I don't know where to look. I don't know anyone. Like, and I just thought this is a huge gap in the field. And then we started putting the team together and starting outlining these issues, and the vision for the Open Therapy Institute came together. But it was like the sequence was like unbearably activist programs, and then starting to realize that the bigger story is all the things that the field isn't doing to help, that it should be doing to help.
Did you have to overcome any personal reluctance, like just fear, for example?
Yeah, I mean, I'd say I think there were a lot of challenges at the beginning to getting started. Like a big part of it was getting my head screwed on straight about is what do I really think? I found a lot of the ideologies that I was confronted at to be very psychologically disorganizing. Like I was like, what? Like if you have to accept your white privilege. So do you think white people have more of advantages than other groups? And it was just very easy to get lost in these ideologies and to just kind of think like, wait. Just view people as people. Like this isn't helpful. When people accept an idea like white privilege, they're also making a racial identification, and they're dividing people into groups in ways that has a certain amount of aggression into it. Just formulating that in my mind took
Exactly.
a long time, because I'm so like, well, maybe they do, maybe there are advantages, but why are we doing this? And just figuring out how to respond to. So I think getting my head screwed on straight. Once I my faith is really important to me too. And I did pray a lot about it. But once I had a connection of clarity of like, I believe this and I have a sense in my heart that it's the right thing to do. And I do feel like I need to say something about it. And the courage piece was not as big of an issue, because it's kind of like, if I'm trying to speak from the wisdom in my heart, that's what I need to do. And the other part wasn't as big. And I will say, I did not, I knock on wood, I feel like I'm tempting fate every time I share this with people, but I feel like it's important to say this. I did not experience the type of antagonism that some people experience in the field. I don't think I've gotten a single piece of hate mail to date. And, I just didn't get that. Now I know people don't like what I say. And so the comments and under what I say, sometimes some of that's like that. But I think I try really hard to, just like what you said, to not write negative things about people, to focus on helping patients that are underserved, to talking about how this impacts people from an empathic perspective. I try to stay true to what comes from my heart and not write from a hateful place. And I haven't experienced the type of antagonism that a lot of people worry that they might get.
Impressive. And it also shows how oftentimes our fears are more imagined than real. Some people do experience a definite pressure and isolation.
Who knows what's going to happen? I kind of think if I keep getting out there and get a higher profile, that will come, I'm assuming. But that's not the judgment of people in the world isn't what I try not to be limited, but to be focused on that, to live my life based on that. I don't think it, and the worst thing that can happen is if you don't listen to your heart, you don't listen to that point of wisdom in your heart, then that light gets more faint and you can lose touch with it. It's actually like really, really important to keep that connection. Is speaking from that place of honesty is very important, or you can lose that connection. And I think that's way worse than having crazy people gossip about you or something.
That's exactly right. The social pressure is very strong for some people. And however, we cannot live a moral life if we judge what's moral based on social pressure, human respects, what other people think. We're not going to be able to live. And yeah, I firmly believe that if you are striving to live a moral life, you will be countercultural. And you're absolutely right that we have to be true to our conscience, our heart, as you say it. And what the other side and the spiritual forces want to do is to force us to violate our own conscience, first in small ways, then in increasingly large ways. Just those acts, for example, like you said, of nodding with something that you don't agree with, which can be kind of justified. It's
Right.
like, well, I wasn't nodding to agree with it. I was just nodding to show that I was listening or paying attention.
Yeah, and sometimes
But
you
that,
might be doing that.
yeah, but little by little, that starts to diminish the light. For example, giving into this trend of identifying your so-called preferred pronouns. I think that's another example of people say like, well, why can't I? Yeah, I mean, I want to be called he, him. Why can't I say that? Well, you're encroaching a little bit on that territory of the conscience where you're not. It's because you don't feel free to say, hey, this is not how I think about myself. I don't want to.
Well,
I don't want to give you that and answer that.
I know that I know we're limited on time, so you'll let me know. But if I could say something about the pronouns thing really quick,
Sure.
I think as a therapist, I think that I think it's inadvisable for therapists to use their pronouns on their professional materials, and the reason is, among other things, it's a political signifier. And so a patient who, I think people that list them, they think, hey, maybe the patient's trans or maybe they know somebody trans, and then I'm going to signal inclusivity to them. That's their internal monologue. But what they're not thinking is there might be people who know someone who detransitioned, or there might be somebody who has concerns about the ideology or the way it's practiced with children or the growth in the identifications or something like that. They're getting the opposite message, that the therapist disagrees with them. That listing your pronouns signifies that political belief. And I think it even stands in for a lot of other social justice political beliefs that, again, they're not stated explicitly, but it is an indication that maybe they support Black Lives Matter or defund the police or they hate Trump. And I think it just brings this, it's a political statement that I can easily see encroaching on sessions. And I think, not that long ago, nobody did it and it pretty much worked fine. And it was very rare that there was ever an issue. And I don't think I ever heard of an issue prior to this becoming trendy. But now the concern is therapists are increasingly just you put your pronouns or you don't, and it's a political statement that now divides the field. And I think that's a really corrosive effect on it. One other thing I'll say about the pronouns, and I know we need to wrap up soon, but I'll just say I think one concern that I have about the pronouns listing is that it can serve to alienate people from their gender. That it's somehow, up until the idea of listing pronouns was introduced to the world, I think most people did it reflexively without thinking like, what are my pronouns? Like, you didn't have pronouns. There just were pronouns. And by problematizing them and making them conscious and challenging and undermining them, I don't think that's neutral in terms of its effect on people, their experience of gender, their experience of sexuality. And I definitely don't think it's neutral in terms of its effect on kids. Now, we don't have data on these types of things, and it might be really hard to get that data. But I think one reason why people might react sharply to it is because they can feel the way that aspects of gender that had been second nature very recently are being problematized and made ego alien, and in a way that actually is very impinging. So I think it's not necessarily just a neutral thing.
These are brilliant points, and I wish I had your ability to articulate responses to these, because one thing that happens is a psychological phenomenon called persuasion. Robert Cialdini. So we're convinced of something before we even realize that we are trying to be convinced. So just framing the argument in terms of, well, what's your white privilege? Well, that already assumes that it's even worthwhile to segregate populations on the basis of race, which is a presumption. We're stepping outside that boundary. And again, with the preferred pronouns, that was a great example, that you're already playing by the rules of their game, which may be based on a false or even harmful assumption.
These things that seem trivial related to gender can potentially have large social effects. And again, I think these are very hard to research. I'm not sure of, and it wouldn't surprise me if they're not being researched because people would be afraid to research them, I think, these days. But I think that there are all different
Hmm.
types of ways that gender, different signs and idioms and signifiers related to gender are getting problematized. And there's, I think, dozens and dozens of signifiers related to gender that are getting problematized all the time. And in aggregate, I think it does really make people feel impinged upon and disturbed and violated. And I think that's a big part of where the anger and irritation about this stuff comes from. I don't think it's, I mean, sometimes it can have lots of different motivations, and sometimes it may actually come from like hating groups of people. But I think most of what I tend to see is just a sense that they're being messed with in terms of their experience of gender, and they just don't want to be messed with that way. And it can be a disturbing, destabilizing thing that they're doing.
Especially when you consider most people are not able to articulate what
Yes.
they're experiencing and how to address it, and they may not even be like fully consciously aware of it, but they just know that they feel
Yes.
uncomfortable.
100%. Yes. They need our field and people in our field to just explain
That's
some of
right.
these things to
Exactly.
them
It's a
to
catch
help them
22.
to help them metabolize what's happening and respond to it. It's like massive social change on dozens of issues. And I think people are struggling to make sense of it and to metabolize to it. And we could help, but I think too often our field is doing the opposite.
Are you going to write a manual with responses for people in these situations, how they can think through it, how they can
Uh,
articulate their position?
that's an interesting idea. I want to do every issue on that chart needs several books. It's a monumental practice, a monumental project of the number of things that we need resources in. And I'm open minded about these things. It's kind of like I gave a behavioral intervention for self censorship, but there's psychodynamic ways of thinking of it, and there's other ways. And I think we need lots of different perspectives on each of these issues. But there's so much that needs to be done.
This is incredibly interesting for me.
Great.
So, can you tell us a little bit about what projects you're most excited about, and uh, if people are more interested, where they should explore further?
Yes. Okay. If you are a psychologist and you're interested in doing clinical work with these populations, reach out to us. We're constantly looking for that. Other clinicians, too, we might be able to work with. Anybody who's a therapist can become a member of OTI, Open Therapy Institute. The membership costs $99 for the year. You get a discount on our workshop, and you can attend a monthly peer consultation group that we do. So that's for therapists. We also have accredited workshops for therapists. We do about one a month. I think our next one is early December. It's on racial and cultural reductionism. And we have some case studies and clinical theorizing about that process and how it impacts people. They're all accredited for social workers, psychologists, and counselors. So anybody with those degrees can come. You can get your CEs from us. If you register early, you get a discount. If you're a member, you get a discount. We also have the research project. We are doing a report with about 50 articles on all of those topics that are outlined there. If people who have a background in writing and are interested in it can reach out. We want really strong writers and sharp clinical thinkers. But if that's people who have a background in that and want to contribute an article or two, should also reach out to us. Our website is opentherapyinstitute.org, and we have a contact button at the top of the page that's easy to reach out, or you can email us at info@opentherapyinstitute.org.
Well, thank you so much, Dr. Andrew Hartz, and keep up the great work. It's so encouraging to know that there's people like you out there.
Well, thank you so much, and thanks for having me.